Hi, I'm Pam Fox at pamfox.org. Thank you for joining me today. In today's video, I've actually been working with a client who is reversing her hiatal hernia, and she's been having a lot of relief interspersed with some occasional symptoms, specifically with difficulty swallowing, and some burping as well, but the difficulty swallowing has been a big one. And so I thought I would come on today and talk a little bit more specifically about, just to help you understand better why you're having difficulty swallowing, to help you see clearly what the true answer is to address this issue, to address this symptom, and to fix it, okay? And so I have 5 things that I want to talk about. Really, there's three things that I want to talk about. I'm going to break it down a little bit further into 5 topics. But basically, when it comes to difficulty swallowing, there can be 3 main things that are affecting your swallowing. One is the presence of a hiatal hernia. 2 is vagus nerve dysfunction, which can occur because of the presence of the hiatal hernia and other reasons, and I'll be talking about those. And 3 is certain medications, specific medications that can actually cause the symptom of difficulty swallowing. So, starting out with a hiatal hernia. The hiatal hernia is an anatomical presence of your stomach pushing up through your diaphragm, right? Through the anatomical hole in your diaphragm known as the hiatus. And so when this happens, this very positioning of your stomach pushing through this hole in your diaphragm can put pressure on what's known as your vagus nerve. Now, your vagus nerve is a nerve that starts from the brain, and it innervates many of our organs, you know, the heart and the lungs and the esophagus, going through down into the abdominal cavity, the stomach and the intestines, and many, if not most, of our internal organs. So this nerve innervates or supplies nerve supply to all of these different organs. Right? And so the analogy I commonly use to help you understand what's happening when we have pressure on that vagus nerve, ongoing long-term pressure on that vagus nerve, is carpal tunnel. So we have a tunnel right here known as the carpal tunnel, and these nerves flow through it. And from overuse, you can begin to have injury and inflammation of that carpal tunnel, which means there's pressure on the nerves now, and you have pinched nerves, pinched nerve or pinched nerves. Right? And that can cause pain and it can cause problems at the wrist, but it also can cause problems in the hand, right? Where the nerve supply radiates out to the hand. And so you can have pain and numbness and tingling and weakness and really compromised function of your hand because of the problem here, right? Because of the pinched nerve in the carpal tunnel. And so going back to the vagus nerve, if you now imagine this vagus nerve is getting pinched long-term over time, right, that's going to start to cause a compromise of the vagal function. And so then what is the function of the vagus nerve? Well, it has a lot of really important functions in the body. Heart rate is one of them. If you notice that if you have a hiatal hernia and you're sweating a lot, there can be a connection between those. Heart palpitations is a big one, and difficulty swallowing. The vagus nerve is responsible for digestion, right? It's responsible for peristalsis, which is the musculature of the esophagus is a smooth muscle tissue, right? Which means it knows how to squeeze and contract and do its job without you telling it what to do, right? If I want to tell my bicep to flex, I can go like that and flex it, but smooth muscle, it knows how to do its job. You know, the muscles of your stomach contract and churn the food without you telling it to do that. Your heart beats without you telling it to do so. Well, peristalsis, or the movement of something through that channel, is the muscular contraction of pushing that and causing that movement. And so if those muscles become weakened, we can have or experience a lump in our throat. We can have difficulty swallowing, because that musculature function has become compromised due to an overstimulated, an irritated, an injured, or an inflamed vagus nerve due to ongoing long-term pressure put upon that nerve, right? And that can happen with a hiatal hernia, okay? So then if we want to really address this symptom, if we want to, you know, cure this symptom, you know, instead of just trying to manage it or, you know, take something that's going to ease the symptom, we've got to unherniate the stomach, right? We've got to reverse our hiatal hernia. The second thing I wanted, or the next thing I wanted to talk about is, so let me just recap. The anatomical positioning of having a hiatal hernia can put pressure on the vagus nerve and create the symptom of difficulty swallowing. But also, and this is something that I believe may be happening with this client that I'm working with, is the reversal process, reversing your hiatal hernia, can also put additional pressure on the vagus nerve. And so that's why I feel it's so important and why I teach gentle and consistent reversal of a hiatal hernia as opposed to aggressive reversal. Sometimes some of my clients get very aggressive with the exercises. They want to get in and really forcibly move that stomach down. You can go to a chiropractor. I've done that before where they forcibly move the stomach down. And keep in mind, this is only one part of a bigger picture of reversing your hiatal hernia. Reversing your hiatal hernia starts with understanding intergastric pressure and the different things that you are probably doing that cause that stomach to get pushed up in the first place, addressing those things. And then it's learning how to move the stomach down and beginning to stretch and move those peritoneal, those adhesions that are holding your stomach up in place. Okay, that's part 2. And then part 3 is learning how to strengthen and tighten your hiatus so it can't reherniate through again. So it's a comprehensive protocol. And if you just focus on aggressively moving the stomach down, you can get in there and without knowing it, be putting pressure right on that vagus nerve through the manipulations. And so that can cause additional pressure on the vagus nerve. Or just, if this is your stomach and it's lodged in your diaphragm like this, and it's really in there good and tight because of those adhesions. Maybe you have additional inflammation that you haven't addressed, and it's in there good and tight, and you begin to move that stomach downward, and it's kind of lodged in there, and it's not freely moving. It's lodged in there. That in itself can put additional pressure on that vagus nerve and create additional heart palpitations or difficulty swallowing. Some of these symptoms that are associated with hiatal hernia already. Now you're putting additional pressure on the vagus nerve. And so then you ask, well, then how could I reverse, how can I avoid this and still reverse my hiatal hernia? That's why I advocate gentle, consistent movement of the stomach. And I know that can be really frustrating. I remember when I was going through that myself, I would have anxiety attacks, which is another thing that can happen due to an irritated vagus nerve. You can experience anxiety. But having this understanding and at least knowing what's going on can at least help you to be like, okay, I know what's happening. I have an irritated or overstimulated vagus nerve. And then one thing that you can do to try to counteract that, it really is just become a pro at relaxing. So if you combine the right positioning of your body, which would mean a comfortable position where your torso is elongated. So just sitting up tall, reclining, lying down, so you're not like in a fetal position or hunched over. That's going to put additional pressure on the nerve. Combine that positioning with relaxative breathing. So the vibratory breathing has been known to help relax or reset or it's hard to really find the right word, gently massage that vagal nerve to help it calm back down. Vibratory breaths, a positioning that's not, putting more pressure on the vagus nerve, such as reclining, relaxing the abdominal muscles. Okay, that's going to just allow your stomach to kind of settle down so it's not pushed up. And the vibratory breath. Also, humming has been known to help reset or calm the vagus nerve. And all the humming is like if you think of meditation and the if you do that right now, you'll kind of feel that vibration, and that's helping to relax that vagus nerve. Those have been shown to relax the vagus nerve, and cold water on the face. Okay, there's a name for that. The diving reflex. The fine tiny nerves of the vagus nerve also come out to the face, they radiate out towards the face. And so by applying cold water to the face, that has been known to reset the vagus nerve and to calm the vagus nerve as well. And so one of the things people do is cold showers. I don't do cold showers. I've even tried splashing cold water on my face. I used to find that somewhat helpful. Or even lying down flat on your bed with a cold rag over your face, I think is probably the most realistic. And then practicing that vibratory breathing. And if you don't know what vibratory breathing is, I'm just talking about when you connect with that little bit of vibration, kind of like when you start to fall asleep. And it almost seems like you're starting to snore without snoring. You're just breathing in and out slowly, and you can kind of hear and sense and feel that vibration. These are the things that are going to help you kind of calm down that overstimulated vagus nerve and hopefully allow the function, again, of that peristalsis to help you swallow. Okay? Okay, so we've talked about the anatomical positioning that can cause difficulty swallowing, the actual process of reversing your hiatal hernia and being too overzealous or over aggressive can cause difficulty swallowing. Also diagnostic testing. So diagnostic testing is something like an endoscopy, which many people commonly have if they've been diagnosed with a hiatal hernia. That's one of the methods that they use. A barium swallow is another method, and it's less invasive because they're not going in. You're swallowing barium and they're putting you in an X-ray machine, which it has its own set of risks. Obviously, you're swallowing barium and they're putting you in an X-ray machine. But with an endoscopy, they're going in. Okay, they're going in or if you've had any type of exploratory surgery. And the surgeons are very careful. They know that they don't want to nick or burn or bruise or cause damage to your vagus nerve when they go in there. And they're very careful to identify that vagus nerve and stay away from it. Unfortunately, it is something that can happen. You can have damage and irritation done to your vagus nerve, and it'll heal. I mean, unless they slice it or cauterize it or something. I mean, if they nick it a little bit or bump it or are a little aggressive with it when they're trying to move things around it, it may get irritated and cause additional symptoms for a few days, but it will heal. Just like once you reverse your hiatal hernia, it will heal. Once you get that stomach down and out of that herniated position, your vagus nerve will have then the time to rest and heal and not have that ongoing pressure put upon it that causes the irritation and the inflammation. But yeah, a lot of the diagnostic testing, exploratory surgery, anything like that where they go in and cause some irritation to the vagus nerve can also cause these symptoms. And so just keep that in mind. Doesn't mean you shouldn't ever have diagnostic testing. I mean, I try to avoid all that stuff where possible, but I know there's a time and a place for it. What's better, an endoscopy or a barium swallow? I mean, I really don't know. Again, they both come with their own set of risks. So, I mean, anytime you get put into an X-ray machine, you're potentially damaging every cell that's being exposed to that X-ray. And so, it might be minimal, but just depending on the person and how sensitive you are, I mean, everybody's going to be different. So that's a choice you have to make on your own. But that's another reason just to help you maybe understand further. Okay, yeah, I did have an endoscopy last week and I've been having difficulty swallowing, and I do have a hiatal hernia, so I have a couple of things stacked up, against my favor that are causing this symptom. And then the last thing is medications. So many of the medications that we commonly take have a relaxation and dilation effect within the body. So again, going back to smooth muscle tissue, those are muscles. And so if we are taking a medication, let's say, I'll list a few of them. Blood pressure medication causes a relaxation and dilation effect in the body, right? And those medications don't know how to target right in. If you have an atherosclerotic artery, right, a narrowing of an artery or hardening of an artery, that medication's not going to go right to that point and cause, relaxation and dilation there. It doesn't distinguish. It's going to, it can be anywhere in the body that it's going to cause that effect. And so unfortunately, when it comes to, these different sphincters in our body, like our lower esophageal sphincter or the muscular tissue of the esophagus, remember that peristalsis is the ability of those muscles to push all of that substance, the food, through the digestive tract. And so if it loses that function, that strength to really, push the food down the esophagus and for the stomach to squeeze and churn and mechanically digest the food and then go through the intestinal tract and so forth, then you're going to have slow digestion, right? So we want good, strong, working muscles when it comes to digestion. And so now we're taking a medication that causes this relaxation and dilation effect, okay? And so that can affect peristalsis as well. And so blood pressure medications is one. Antidepressants, again, they cause a relaxation effect. Anti-anxiety medications, sleep medications, they cause a relaxation effect. Asthma medications cause the relaxation and dilation of the alveoli and the respiratory system to help you breathe. And again, I'm not telling you to go off of these medications. They may be saving your life. But in my opinion, whenever we go on a medication, we need to assume that it's for the short term. And so that if you're taking a medication and your doctor says, you have this disease and I'm sorry to take this medication for the rest of your life, I would really encourage you to question that. And while there are situations where that may be true, there are many, many situations where doctors will tell their patients like this, and it's not true. It is not true. In fact, something like 75% of conventional chronic disease is reversible. It's reversible through alternative methods that your doctor may not know about or may not even be mentioning to you, okay? And so then we get into, the realm of, nutrition and lifestyle and those types of things. And that's not necessarily what doctors are taught in med school. They're taught to diagnose a specific disease and give the according prescription for that disease or refer you to a surgeon or whatever. And so what I always try to encourage people is to really understand that there's a certain mindset that we have that says, like plant-based nutrition, for example, sounds like a very extreme diet. We've all been on diets before, we've failed on diets before, and so then we begin to tell ourselves that, a plant-based diet is so extreme, I could never adhere to that long term. When the reality is plant-based nutrition it's a plant-based diet is the only diet that's ever been proven, going back to heart disease, to reverse heart disease, to stop it dead in its tracks, to cure it, to cure heart disease. It's the only diet that's ever been scientifically proven to reverse heart disease. And I'm referring to, it's been repeated actually, but Dr. Caldwell Esselstyn specifically, his patients, I think it's been 30 years since he did his work. He's a surgeon at the Cleveland Clinic. He's still promoting plant-based nutrition today, even though, my goodness, I don't know how old he is. He's got to be approaching 90. I don't know. I'm not sure how old he is, but he's up there. But his patients, 30 years later, not only are they still alive, and these were patients that were on death's doorstep. I know I'm getting sidetracking from the hiatal hernia, but I always have to throw in a plug for nutrition and lifestyle because, those are the ways that we effectively reverse chronic conditions, not just manage. But his patients 30 some years later are not only still alive, these were patients that he asked the hospital to give him the ones that, had no hope, the ones that their doctors had given up on, the ones that were going to die soon. 30 some years later, these patients are all not only just alive, but they are thriving. They're lean, they're strong, they have no heart disease, they're taking no medications. Why? Because they went on a plant-based diet and they stuck to it all of these years. And the couple of people who aren't still alive or they did have cardiac events after the test, after the research, it's because they went off the plant-based diet. And only a few of them did, and when they had their cardiac event, they either came back to the diet or they died. So there's strong evidence that's proven that a plant-based diet can reverse heart disease and other chronic degenerative diseases such as type 2 diabetes and certain types of cancers. I think colorectal cancer. So it's just a mindset shift of getting to a place where you say, yes, I want to effectively address and reverse disease. When it comes to your hiatal hernia, many, if not most doctors will say you cannot reverse this condition. I've done it and I've helped several other people do it as well. And it's done through nutrition and lifestyle. It's not done through pills. Okay, so I think I touched on everything. That's it for today, guys. If you want to learn more about reversing your hiatal hernia, and plant-based nutrition. I have tons of free content here. Just follow me here on Facebook. I also have paid content on my website, pamfox.org. You can check that out for my courses and my coaching services. I'll go ahead and take one question. Liam Kiley asks, what are your thoughts on the Acid Watcher diet by Jonathan Aviv? Been on it lately and it really seems to be helping. I totally support the Acid Watcher diet. In fact, I've run my own 30-day challenges here in this group for a plant-based diet that eliminates all common trigger foods. So it's really taking Dr. Aviv's diet and taking it to the next level, where we're doing a plant-based challenge for 30 days and still following a lot of his principles in terms of eliminating all of those common trigger foods, those more highly acidic foods. All Jonathan Aviv, I think, in order for him to make his diet a little bit better, is to eliminate meat, dairy, and eggs. So yeah, I totally promote that diet. I think it's great. It's just not quite as good as it could be, but a lot of people have been helped by this diet. And if you guys don't know what Liam is talking about, Dr. Aviv has the Acid Watcher. I was going to grab the Acid Watcher Diet and the Acid Watcher Diet Cookbook. You can buy those off of Amazon. There's also a free Facebook support group called the Acid Watcher Diet on Facebook that you can join and just read what other people are experiencing on this diet as well. Will it fix everybody 100% of the time? No, but it helps a lot of people. For some, they need a little bit more additional support, and taking it to that next level by trying a plant-based diet with a lot of the principles that Dr. Aviv talks about will do the trick. With that being said, a lot of people think that a plant-based diet, again, is too extreme and they could never take it that far, and that's just a mindset. Plant-based nutrition is just as nutritious as any diet that of any other way of eating. You just have to learn how to prepare and cook your food a certain way. When it comes to an Acid Watcher diet, however, it is a blander diet, so you have to get more creative. I mean, you omit vinegars, you omit lemon, you omit spices like, hot sauce and things like that. So it can be a little bit more bland. So there's definitely a learning curve to reset your palate so that you can start to really appreciate the flavors and the gentle nuances of food without all of those additional spices. So that's something that has to take place, but also just learning how to cook a little bit differently. Maybe you're going to use, more herbs like cilantro and flat leaf parsley, and so forth. And you have to figure out what's trigger for you and what's not. So what's trigger for one person may not be a trigger for other person. So you have to figure out what that is for yourself. So Liam has a follow-up question. How do we get B12 on a plant-based diet? Well, I supplement. Personally, I've had my blood test done. I've been vegan now for 5 years, and I've personally never had an issue with B12, and I probably remember to take a supplement, a B12 tablet, a couple times a month. It does store up in the body, so it's not necessary to take it every single day. In fact, I've heard a lot of vegans getting their blood work done, and they're too high in B12, which can be problematic as well because they are supplementing every single day. I cook with nutritional yeast, which has B12 in it. What else has B12? Some of the fortified plant milks have B12 in them. So, I mean, it is fortified in certain foods. And then it's naturally occurring in certain foods as well. So just need to do a Google search of those and try to incorporate those into your diet. But I just get my blood test done once a year, and it's never been an issue for me. So personally, I'm not that concerned about it. And like I said, I do have a supplement, and I just pop one of those whenever I occasionally think about it. It's not something that you want to just have a blasé attitude about, though. B12 deficiency is a serious thing, and it's actually common across the board among meat eaters and non-meat eaters. So it is something to pay attention to, and it's something that it can cause serious effects within the body. So we want to make sure that we're not deficient in B12 and all of our vitamins as well, and minerals. So good question, Liam. Okay, I could talk a lot about B12, but I do need to get going. So yeah. All right, guys, we're going to end it there. Thank you so much for watching.